Hello, I'm Mabel Jong, and you're watching the World Healthcare Congress Interview Zone, and I'm so pleased to have Dr. Theresa Rohr-Kirchgraber in the studio today. Dr. Rohr-Kirchgraber. I was doing so well, but I'm pleased to see you. I am so pleased to see you.
Thank you.
Now, you are with the Indiana University's National Center of Excellence in Women's Health, and I need to ask you, how organized are health services for women now? Is it getting better for them? And why hasn't it taken so long to get organized?
Well, the National Centers of Excellence were established many years ago through federal funding. And at that time, the idea was to create women's services in one location so that a woman had more opportunities to get things done in one place rather than in multiple. But it was more than just the clinical services. It also incorporated research opportunities, leadership opportunities, and it really reached out to the community. Those initial models were fabulous, and I think that they really are the models for the medical home that is now currently being established. But even though they were fabulous when they got started, and there are still many of the centers that are still ongoing, I think that the focus on women's health has improved, but we're not quite there yet. There is still a significant disparity in terms of the treatment for women and in terms of understanding the differences, the gender differences between medications for women and how those diseases present.
Are there incentives available today to really encourage people to be better at this?
There are definitely business incentives. I mean, we just had a lecture that discussed the business model for women's health, in that when you saw a woman in the office and you took additional time with her, so even though those initial visits were a little bit longer than what you might normally have, by doing so that you actually saved money in the long run, because that woman was more likely then to make the changes that were necessary and to then bring in their families for further visits, and it helped to decrease the number of people ending up in emergency rooms or other things like that. So there definitely is a business model, because we recognize that women are really the positive change for their families. Women really run the healthcare when it comes to the individual and when it comes to their community and their families. So bringing them into the fold definitely influences what your business model is going to be.
Are there enough health services geared just for women, or are you seeing the rate of growth in this area increasing even further now?
I think the rate of growth for women's health is definitely increasing. Is it going at the speed that we would like it to? Perhaps not. Partly because there's been a significant decrease in funding, and that negatively impacts. I mean, for example, when the National Centers of Excellence were put together many years ago, the initial investment was $12 million. The amount of services that came out of that was over 500,000. Was over 500. I'm sorry. Was over $500 million in return. So the amount of your investment for that original 12 million was astronomical. It's really been the best program of all the programs in terms of return on investment. But that program is over, and we need to keep it going. We need to continue to make the inroads that gender makes a difference. Rather than have a drug come to market and then have it to be pulled off a few years later because the initial drug was only looked at in men, and then when it came to market we recognized that there were significant problems when it was given to women. That's a huge deficiency. Let's start it from the very beginning. Let's include the women into clinical trials more. Let's include us into the discussion about the care and about the differences in the way the disease process manifests.
And who does this message need to be highlighted for? Who needs to hear this?
You know, we all need to hear this, because it needs to be a grassroots problem. It needs to be something that the woman in the community, when she hears something's going on and the legislative writes the letter to say, no, not in my hometown, not in my backyard. It needs to come from the physicians, because we need to be able to say, these are the changes that have to happen. We need to be able to look at the clinical evidence and to document which clinical practices actually make a difference, which clinical practices really work within that segment of the population.
Okay.
You know, and it needs to come from the federal government. It needs to come from those institutions that are currently doing the research to make sure that they incorporate women into the research protocols, to make sure that they be looking at the gender differences. Disparity is not just by the color of the skin. Disparity is by the gender that you are. Disparity is by the economic background that you have. And disparity is by your educational level. There's so many different things to be looking at when you're trying to decide where the dollars need to go.
Okay, and let me ask you, Doctor, what should women be looking for when they're shopping around for a provider, for a system to address their needs?
When a woman is looking for a provider, they need to look for somebody who would be approachable, who is willing to chat and to listen. That doesn't necessarily mean that they have to spend an hour in the exam room with you. It just means that they need to be able to answer your questions appropriately. They need to be able to have resources available for you. They need to be able to direct you if they don't know where that person should go. Usually the best way of finding a provider is by word of mouth, but that's not always fabulous, because even though you might have the exact right person, if you're not on my insurance plan, I can't see you. There are certainly different organizations that are very proactive in terms of having women's health issues out there. Looking for somebody who is talking about women's health, who's promoting it, who's giving talks and speeches. It's a great way to kind of get to know who the local providers are in your community.
All right, great words of advice. Thank you so much, Doctor, for stopping by.
But thank you.
Really appreciate it. I'm Mabel Jong. Thanks for watching.